Welcome back to the channel. I am Dr. Azmat Riaz, a clinical assistant professor at the College of Medicine, University of Ajman in the United Arab Emirates. This is part 2 of the lecture. This lecture is mainly aimed for our undergraduate medical students. However, if you are pregnant or if you want to get pregnant in the future, you may benefit from this lecture. In the first part, we discussed many things, especially the role of folic acid in pregnant women, its importance, why it is important, which vaccinations should pregnant women be offered, and what is the best time for air travel for pregnant women. So, if you want information related to any of these topics, you can have a look at the part 1 of this lecture. In the second lecture, we will start with what routine tests are offered to all pregnant women, and this is based on the Dubai Health Authority guide. We call it DHA. So there are a set of tests which should be offered to all pregnant women, regardless of whether they are low risk or high risk. So in the first trimester, so we know that first trimester is up till 14 weeks of pregnancy. So in the first trimester, these tests should be performed, and these tests include blood group, which includes whether they are blood group positive or negative, and that's important. It also includes doing a basic test that's called complete blood count, or sometimes it's called full blood count, that gives basically idea about it gives a lot of information, but mainly we want to see if a patient is pregnant or not. Then we screen for some infections, and and they include testing for syphilis. That's the VDRL test usually. Some laboratories also perform a test called RPR, rapid plasma reagent, but usually it's the VDRL which is performed in Dubai. That's for syphilis. Then we check for rubella. Rubella is an infection, and if a pregnant woman is exposed to rubella, if she's infected with rubella in the first trimester, especially, it can have disastrous consequences. So, but if a woman is already immune to rubella, which is shown by rubella IgG, that's a good thing to have. So, having immunity means she has antibodies developed against this disastrous infection, and she can prevent her baby. If a pregnant woman is not immune against rubella, so we should not offer her vaccination for against rubella in pregnancy. However, she should be vaccinated after delivery. It's safe even during breastfeeding. Then the next test, the next infection, that's hepatitis B. So we do this hepatitis B surface antigens, and for high risk women, we check hepatitis C antibodies. So by high risk, I mean it can be even a nurse, doctors, or if a pregnant woman has someone with hepatitis C at home. Then we check all women, regardless of their background, for HIV. Then we check their urine. So in urine testing, basically we look for if there is any glucose in the urine, if there is any protein in the urine, if there are any signs of infection. So there will be a separate lecture on urinary tract infections in pregnancy, but so we check a baseline, we do a baseline urine test. For women who are at high risk, we have to do a test which is called oral glucose tolerance test in the first trimester as soon as possible, but definitely before 16 weeks. So what do we mean by high risk? That means if a woman previously had gestational diabetes mellitus in one of her previous pregnancies, in any of her previous pregnancies, if, say, for example, if it's her third pregnancy, and in the first pregnancy she had gestational diabetes mellitus, which means diabetes in pregnancy, but her second pregnancy she did not develop gestational diabetes, still she's considered high risk. And then we have to offer her oral glucose tolerance test here. Okay, so this is for this first trimester, and I will come back to the ultrasound scans later on. On the follow-up visits, of course, we have to perform some tests, and this is for singleton pregnancies. We are not talking here about the twins. Okay, so between 24 to 28 weeks, for high-risk women, we have to perform oral glucose tolerance tests. So if there is a woman who was tested here, oral glucose tolerance test, if she had previously has had history of gestational diabetes, we tested it in the first trimester. If she is tested negative, then should we repeat it at 24 to 28 weeks? The answer is yes. The reason is because this placenta secretes many hormones, right? It has many functions, and one of the functions is to release a hormone which is called human placental lactogen, and the levels are very high during this time frame, 24 to 28 weeks. So this is the best time, and this human placental lactogen is actually, it is kind of anti-insulin, so there are more chances of developing diabetes, maximum chances during this period, although some women, they can develop gestational diabetes even later than this, but this is considered the best time. So, from country to country, the guidelines vary. In the USA, everyone is screened for gestational diabetes mellitus, and they are offered, the women in the USA, they are offered oral glucose tolerance test. All women in the UAE and the UK, we do selective screening, which means women who are at high risk of developing diabetes mellitus, and there is a long list which is coming in another slide. Only selective screening is performed, which means not all women are offered oral glucose tolerance test between 24 to 28 weeks. The next question is, if a woman was screened here in the first trimester, oral glucose tolerance test was performed and she tested positive, do we need to repeat it again here? The answer is no, because that's actually a diagnostic test. Oral glucose tolerance test is the best test to detect, it's a diagnostic test to detect gestational diabetes. So if someone is tested positive here, then that means they have diabetes, and most likely, because it is detected early in pregnancy, so most likely the woman actually had type 2 diabetes, but it was detected for the first time in pregnancy. So by definition, still we will call it gestational diabetes mellitus. So oral glucose tolerance test. And what kind of oral glucose tolerance test? Because there are different types. So in the UAE, we perform 75 gram 2-hour oral glucose tolerance test. And by 2 hour, we mean that actually the patient has to undergo 3 blood samples, one fasting, then they are given a sugary drink of 75 grams of glucose, and then blood sample is taken 1 hour after taking that sugary drink, and then a third sample actually, so 2 hours after taking that sugary drink. So that's called, the full name of the test is 2-hour 75 grams oral glucose tolerance test. That's what we do in the UAE and the UK. So at 28 weeks for singleton pregnancies, we have to repeat a complete blood count, or sometimes it's called a full blood count, which also tells us about, of course, the platelets. So why I have specifically mentioned platelets, because in pregnancy, some women develop a condition which is called gestational thrombosis, which it actually occurs in the third trimester. So if someone has thrombocytopenia detected early in pregnancy, it is least likely to be gestational thrombocytopenia. It can be something else. It can be related to some other condition, for example, immune thrombocytopenia, but it is least likely to be gestational thrombocytopenia, because gestational thrombocytopenia develops late in pregnancy. Then, if indicated, we have to give NTD to the pregnant women if indicated, but that's a separate topic. At 28 weeks, again, some women who are at more risk of developing small for gestational age or IUGR baby, then we have to start fetal growth scans. Again, this is important to understand that we're talking about singleton pregnancies and not twin pregnancies. At 36 weeks in the UAE, we do universal screening for group B hemolytic streptococcus. So again, the guidelines are different. In the UAE, we check everyone, all pregnant women who are likely to have a normal delivery. We have to take a low vaginal swab for GBS or group B hemolytic streptococcus. In USA also, there is universal screening for GBS for pregnant women. In the UK, no, it's not done until and unless it is detected incident. We will discuss the importance of having GBS in a later slide. Now, screening for Down syndrome. I hope you understand that Down syndrome is it's actually the most common chromosomal abnormal in fetuses, and it is important to offer screening to all pregnant women for Down syndrome. There are different screening methods. Some are more reliable than others. For example, even just the age of the pregnant women, that makes a lot of difference. So especially the cutoff is 35 years of age. Women who are more than 35 years of age, they are more likely to have a baby with Down syndrome. But does that mean that women who are less than 35 years of age, they cannot have a baby with Down syndrome? Of course, younger women can have babies with Down syndrome. So that's why it is important to offer screening for Down syndrome to all pregnant women. Now, how do we offer screening? We have some blood tests. So blood tests means there are biochemical markers, especially in the first trimester. So there are blood tests or biochemical markers which we can offer in the first trimester, or if the patient is late booked, or if she presents late, or if later on she changes her mind after first trimester, yes, we still can do some offer her some screening tests. And then we have ultrasound markers, so we can see some issues on ultrasound, and there is an ultrasound scan which is called NT scan. So NT stands for knuckle translucency. Knuckle is the medical terminology for actually it's the neck fold, neck folds, the skin at the neck of the baby, how thick it is. That's what it simply means. So on ultrasound, if the thickness of the skin fold behind the neck of the baby that's increased, that baby may be having Down syndrome. So we will. So if a patient comes early, if she's booked early, between 11 to 14 weeks, we can offer her these tests that's called double marker. By double marker, we mean the blood test will be a pregnancy associated plasma protein A or PAPE, and then we have free beta HCG. So this is the double marker test. And between 11 to 14 weeks, we have to do knuckle translucency scan. Okay, so these two tests are performed between 11 to 14 weeks. And by the way, it's not only specific for Down syndrome. So if there are abnormalities in the knuckle translucency on ultrasound, or knuckle translucency thickness, or the double marker testing, the baby may be having some other issues apart from not specifically Down syndrome, which may include even trisomy 18, which is called Edwards syndrome, or trisomy 13, which is called Patau syndrome. The first test for screening which we can offer is that's called combined test. Combined test for Down syndrome, that's performed between 11 to 14 weeks, or 11 weeks to 13 weeks and 6 days. That's kind of almost 14 weeks. So why is it called combined test? Because there is a combination of a blood tests, the two tests, PAPE and beta HCG, and then add that with knuckle translucency scan. So perform knuckle translucency scan and then perform this double test, the double marker test, right? So, but sometimes patients may present late, or initially they may decline to have testing, this screening test for Down syndrome, and later on they may change their mind. So what we can offer? Then we can offer some other tests, which is called quadruple test, that's performed between 11 to 20 weeks, and that does not include an ultrasound scan. However, it includes testing, as the name suggests, 4 blood tests for 4 biomarkers. The first one is alpha-fetoprotein, then we have inhibin, HCG, and then estriol. So these, practically speaking, nowadays, less frequently we use this quadruple test. More frequently, yes, we offer combined tests.